appreciate what everyone in this audience is doing and contributing to mental health, and particularly here at UND, because my firm belief is that we need to make this as a regular part of a safety management system and incorporate this at the earliest stages so that this becomes normalized. I was speaking with people earlier, and I remember 25 years ago when we started with cockpit resource management, crew resource management, and there was a talk in London last week about the uptake of acceptance of that. And there's a large group of people who are older and don't accept these new concepts, but over time it becomes normalized because we've started it at the earliest stages of training. And that's what I see happening in the area of mental health right now, as far as a critical component of safety and personal wellness in aviation. So today I'm going to talk a little bit about some personal responsibilities, some best practices in aviation mental health and peer support programs in particular, and some challenges that we have ahead of us. And my clicker isn't working. Or maybe I'm... There, oh, I went too far. Apologize here. So the back clicker isn't working. Am I good? I'll start from here. What the heck? Oh, it is. Okay, good. So, that's not supposed to be there. So, a lot of the hidden slides are being displayed. Oh well. I'll skip over some of the stuff, or I'll talk longer than I intended. One or the other. Okay, I'll talk longer than I intended, if that's okay with you, Beth. Validity of peer support programs. It's been proven through many media that peer support programs are very helpful. In this sense, the Center for Medicaid Services approves payment for insurance for those services. So they wouldn't approve payment unless it was validated. So it was validated back in 2007, and then Mental Health America, additional validation of that. Let's see what. Okay, it seems like the slides are a random number generator, so I will speak to whatever slide comes up. But one of the questions I always ask when I speak to groups like this with pilots, and we have a lot of pilots here, how many use a checklist, a written checklist, every time they get in an aircraft, see if that aircraft is ready to fly? Okay? I hope the hands that are down are non-pilots. Okay. So the next question becomes, how many people use a written checklist on themselves as a pilot or a crew member to determine if they're ready to fly, and they use it every time before they fly? 2 or 3 hands, 4 hands? Okay. So the pilot is the component of the aviation system that is most likely to fail. And what's more important is when you're checking out in an aircraft, usually you get some sort of dichotomous indicator about whether the plane is good. You get a red light, a green light, yellow light, whatever, okay? But for pilots, we are always on a continuum of mental wellness, okay? And so it's very, very difficult to make a good assessment unless this is something you do on a regular basis. So the FAA has some particular guidance about that. And we talked about the PAVE checklist, the pilot aircraft environment, and I have a list right there, a URL for it. But that's part of our checklist that we're supposed to use before. It's the FAA personal minimums checklist. So in addition to looking at the aircraft, we have a responsibility, a personal responsibility, to assess ourselves as we're getting in there. And what's the reference we use? Well, the Aeronautical Information Manual 8-1-1 talks about the I'm Safe checklist. And a lot of these personal minimums really follow that guidance: illness, medication, stress, which we're talking about, alcohol, fatigue, and although the AIM says emotions, now all the pilot operating handbooks have been changed to say, excuse me, eating and hydration. So glad everyone's eating and hydrating themselves right now. What's our personal responsibility? Erica, you're going to be talking about resilience. So we have a personal responsibility to be resilient, and I have a couple of definitions up there. Erica's probably going to go into much more detail about this since she teaches the class in it. But a component of self to recover from adversity, okay? And we're all facing some degree of adversity in our lives. But the ability also to recognize, absorb, and adapt to disruptions. That's resiliency. And it goes through this process of self-evaluation, knowledge, skills, and application. So have any of you students heard this before in a different format with the FAA? No one. Think about the DECIDE acronym that you have up there, and I've listed it up there. That's part of the assessment process, and that's exactly what resiliency is. That trains us to adapt to unusual situations, to reassess that. So that's why it's so important. And how do we develop resiliency? Well, there's an organizational resiliency, but there's also personal resiliency. And how do we do that? We optimize our health. And I've listed some of the countermeasures here that we can take, both from a physical, from a psychologic, and a social area. So this book that I have displayed by ICAO, I always preach this book. I believe it should be in every pilot's library. And it talks about our personal responsibilities for increasing our wellness and our fitness to fly. And in fact, the title is The Fitness to Fly Medical Guide. It has one specific chapter out of the 9 on mental health, but it also has ones on fatigue, on mindfulness, on drugs and alcohol, etc. So these are all our personal responsibilities. But if we do everything that we possibly can to make ourselves the best pilot, the best component of the safety system we have, we're still going to have challenges in our life. So let's talk about that. Oh, geez. Where am I going here? Okay, I'm sorry. Here. We have barriers to those challenges, and why don't we reach out for help? We've talked about some of this already before. The shame and guilt, particularly in the area of mental health. The stigma associated with mental health, although I'm very encouraged because what I see in the Gen Z group is less stigma associated with mental health issues, more willingness to seek help. Crusty old guys like me, we deny that we have any problems at all. There may be a lack of familiarity with the resources. What I love seeing is we have the uplift shirts and sweaters that people are using. You're marketing it. I'm wearing the HIMSS pin here. We want to market that. We see in the airlines people using lanyards to market everything so that they're aware of what the resources are. And then as pilots, we're our own worst enemies. Who are we as pilots? Okay? We're egotistical. We're narcissistic. We don't ask for help because we're problem solvers. Okay? And all of that make us great in the cockpit because we can go through that DECIDE acronym, but it makes us really lousy in saying, hey, I'm failing and I need some help. So we're very, very reluctant to come forward. And then as we spoke about in the first panel, there's certainly a fear of certification, adverse certification actions that can make us not seek health care. And what Dr. Hoffman was talking about, that's a real thing that now has been quantified, which we all knew intuitively before. So let's talk about salutogenic. Has anyone heard that word before? No one? Okay. So has anyone heard the word pathogenic? Okay, a few people have heard pathogenic. Pathogenic focuses on disease. Salutogenic focuses on wellness. And that's what we want to do. We want to move the bar so that people are focusing on wellness. So here's a description of it about it removes the dichotomy between health and illness. We're all on somewhere in a spectrum on this. And it is a proactive, preventive approach to optimizing our wellness. And that's what we're seeking to do right here. So I've talked about pathogenic, disease-based versus wellness-based in there, but it's a focus on our well-being, and in particular, our mental well-being. I'm sorry, I'm moving around, so I'm a moving target for you, all right? But it's a collaborative approach, too. There are many people that help in the salutogenic approach. Okay? It can be peers, which is why we're here. It can be the organization. And in the context of aviation, we also have the Civil Aviation Authority that has the certification responsibilities for us. But if those certification policies allow people to seek help, as was discussed today, then we're moving the needle forward toward more safety. Right? I must give credit to this. Dr. Sanjeev Sharma was the former medical director at CASA, the Australian Aviation, and Kate Manderson, she's there now. Dave Fielding has worked closely in this field, and he works with the Center for Aviation Psychology as well. And Laurie Shaw is a pilot from Australia who has created 2 peer support programs at 2 different airlines in different countries. So these guys are way ahead of and Kate, are way ahead of the curve on this. So we talked about the spectrum here. And let's look at the spectrum that's up here. We would all like to be in the green, and if you look at the details on that, that is how we take this proactive approach based on that book to try to move ourselves into the green on that. Normal, and I would say normal is healthy as well. Okay? But we're all faced with disasters in our life. Sometimes the disasters are trivial, sometimes the disasters are very significant, but we're all going to face them. It could be breakups when you're in college. It could be the death of a parent, death of a loved one. There could be some financial challenges. There could be failures on flight tests, things like that. They're all issues that may move us into the reacting category. Right? And when we're in the reacting category, we need help. Okay? We can benefit from help. Many of us don't ask for help, but we can benefit from that. So look at the things in the reacting category. This is where I think peers provide a wonderful, wonderful benefit. And this is where most of us will be sometime in our lives. All of us will be there sometime in our lives. When we move into the orange and the red categories, those are people who need professional help. So later I'm going to talk about an escalation policy. Okay? Peers are very, very effective in solving about 80% of the issues that we'll see in the yellow part of that spectrum. Right? We need mental health providers to assist us when we move into the into the orange and to the red section, okay? And that's where they get involved in certification. I fully believe clearly in the green section, certification is appropriate. In the yellow section, certification is still appropriate if the person can do it. In the orange section, maybe, maybe not, maybe a short time down, and then go back to fly after appropriate treatment. If you get into the red section, you probably need some serious help and may or may not be able to return to fly, but the bottom line is it's about your health and it's about safety of the system. Man, it was twitchy. So how does the salutogenic approach fit into a peer support system? Well, Wendy Santahano is a wonderful captain from South African Airways who has done a ton of research on this stuff. And I have 2 quotes from her, but I think her quote here about the objective of peer support is very, very important. And for all of you peer volunteers who are out here, this is the value that you have here. You help people regain the agency, their sense of control of what's going on. And as pilots, we like to feel that we're in control. But by having some guidance, just like a benign CFI who's out there to help you with this problem. A peer can bring someone along when they're facing these challenges and give them the power, the agency to make those, to make the help that they need. We can do that. So this is peer assistance. This is not in an aviation context, but this is the initial work on peer assistance that was validated here. We share a common interest. We share a common knowledge, we share a common experience, and we're helping each other in that situation, okay? But it focuses on a preventive approach and on wellness. Right? So that's where we want to move. We don't want to react to disease. We want to optimize performance and wellness. So this was from Dr. Carsten Kemp, who is both a physician and a captain at Lufthansa back in 2016. And he talked about why pilots need peer assistance here. Basically, pilots will talk with other pilots. When I think about my career in the Air Force, when I was in the clinic, I did about 9 to 10% of my medical duties, and that was usually administrative. The real good I did was the 90% of the time in the backseat of an F-16, or sitting in the squadron, or sitting at the O Club, where you were in that pilot's environment and they were comfortable working with you, and that's exactly what peers do. Okay, you're one of them, and you can assist them in that. And the safe zone concept is extremely important. And again, we talked about it this morning. Peer support is not reportable to the FAA. So that's a safe zone addressing the certification fear that's out there. Okay, so the pilot fitness arc is a result of German wings. We convened that. There was about 12 of us in the medical expert working group looking at mental health. And this is one of the statements that came out in the report, but I want to emphasize the part in yellow there about it's a trusting relationship with a fellow pilot in a peer-supported program provides the best opportunity, and that's what we're looking for. That's where UND is really pushing the envelope here and getting the best opportunity to engage that individual and give them the resources that they need. But it's based on a safe environment and mutual trust and cooperation. And there's no one you trust more than a peer. I mean, I'm a knowledgeable former AME, but I would expect fellow pilots to trust fellow pilots rather than coming to me, although I hope they would come to me. Okay, likewise overseas, the European Cockpit Association, the European Association of Aviation Psychology, we have Dr. Becker here, came up with that their peer support programs are proven successful in doing this while minimizing career jeopardy, okay, and improving health. So this is out of their statement, a joint statement by that group. And then going back to the Pilot Fitness Arc report, this is the key. What we want to do is incorporate mental health, mental wellness into a natural part of the safety management system we have so that we improve the performance of individual aviators, that we improve the safety of the system, and that people will also be healthy because they're not afraid to engage. And that requires a just culture, a safe harbor environment, and that's again what peer support provides. Just a bunch of recommendations here, the validation of peer support. There are a bunch of authorities with a lot of people who have studied this and say that peer support is the way to go. It's the way of the future. So what are the different peer support models? And this is primarily based on the airline experience because they do have peer support models in place. Our HIMSS program has been in place for 49 years. Most of the other programs have come up perhaps in the last 10 since that. But UND is leading the fight here on bringing it down to a level, and there are different challenges for the student pilot level. So we can have a system where there's pure peer involvement, no one else. I think there's flaws with that because you don't have an escalation opportunity. You have peers with external mental health resources, and some of the airlines are using that. You can have a peer support program where there are indigenous mental health providers, and we have that here too, which will be incorporated. Kaylee? You have ones where resources can be available to an air crew, and in a sense that's almost like the military model with the flight surgeon that's out there. Or you can combine all of these, and many peer support programs will do that. But the common theme here is safety and wellness. Okay, that's what they're about. So these are the areas that the airlines already have peer support models established. And then look at the HIMSS program is for substance abuse. We have the critical incident response program when people face tragic things, usually on the job, but not necessarily. Mental wellness is what we're all talking about here. But we also have peer assistance programs for pilots who are failing training events to help them get through that check ride-itis that we were talking about just in the last presentation. Professional standards, two pilots who don't play well together in the cockpit and have a disagreement, and that can be sorted out. That's usually only a peer level. That doesn't usually get escalated. So that's one of the examples of a peer-only environment. Aeromedical assistance, and then more recently, in the last year, we've seen a great effort that I think is very important about diversity and inclusion, because there are certain underrepresented populations that may have unique problems and not have the opportunities for the assistance that the majority has. So I think this is very important. In fact, it was just about 2 weeks ago, I was at the Airline Pilots Association. We had a big diversity and inclusion summit with the National Gay Pilots Association, which was extremely good. This is the scope of problems that people will face and will contact peers with. This is perhaps in the yellow level as opposed to the orange and the reds, but these are problems that we're all going to face sometime in our lives. So what are the key elements? And I had about a dozen, but in the interest of brevity, I've shortened it to a fewer of the key elements that I think are important in a peer support program. I should have trust first, right? Yeah, trust. Trust is the absolute essential. Without trust in the system, a peer support program is going to fail. So you need that. Everyone involved needs to trust it. The pilots need to trust the system needs to trust the pilots. The regulator and the AME may have a more remote role. Hopefully here the AME gets involved earlier. Dr. Christensen is there, Dr. Morgan. You'll get involved earlier, but the regulator can get involved later. But to be able to stand back and trust the system is important from those with certification authority and a regulatory authority. Tanya Harder is the chair of the Human Performance Group for the International Federation of Airline Pilots, and she had a wonderful quote about this. Trust is really the main issue. Trust from the pilot, trust from the company, from the regulator. We need to buy into all of this. So that's the key element. So the second key element is confidentiality. Okay? If someone has any concerns that what they've expressed, what's very difficult for them to express, to pick up that 800-pound phone, make the phone call and say, I need help, they need to know that that's going to remain confidential. And I do believe that any peer support program needs to have a written, explicit confidentiality policy in place that everyone needs to read and sign every year so that they know, and it needs to be available to the pilot who's contacting the system so that that pilot knows that his or her information will remain private. Now that's not an unlimited situation. Certainly if we get into the situation where there's a threat to safety, harm to self, harm to others, imminent threat, there has to be some guardrails to allow a break in that confidentiality, and that's through an escalation policy that we'll talk. But if that confidentiality needs to be broken for those reasons, again, that needs to be written, and we need to describe exactly what we're going to do. This is not something you can wing when the problem comes up. You need it defined beforehand so that everyone's on the same page. So what are the limits? I already talked about most of these right now. Any threat to self or to others, the safety of the air system, imminent threat, needs to break confidentiality, and we need to take steps to intervene to get that person the help they need, number one, but also to preserve the safety of the airspace system. There may be some limits. We talked about it, Dr. Danzig spoke about it. States may have different requirements under the TerraSoft laws about what's reportable, what's not reportable. But you as peers out here aren't bound by those laws. you have a responsibility to escalate these if you have concerns. Cooperation, we already talked about. Everyone needs to cooperate in this. Everyone needs to buy in. This is not an individual effort. This is not some component. You need absolute support. And the most successful programs I've seen in the airlines are those where the company management comes in and says, we're 100% behind this, okay? And we have different airlines that have done that very well. We had the advantage of a conference, International Peer Pilot Assistance Conference last week, and we saw airline management analogous to the leadership here. Beth, you've fully committed at the highest level. I mean, UND is all in on this stuff, and that's really what you need, okay? We look at regulators as well, and so there needs to be some independence from the regulators, but the regulators need to trust what's going on. And I believe now at the FAA, we do have that commitment to move forward and trust the peer support programs. I put a reference to the EPSI, the European Peer Pilot Support Initiative, and I'll have some documents later which I think are really outstanding. But again, Gerhard Vandenbroek, who is a Lufthansa pilot and also a physician as well, talks about the independence of the program being absolutely essential. What's another key element is access. People who have the courage to pick up that 800-pound phone need to know that they're going to have access to the resources to help, and that access will be fairly quick in that. Now, in the old days, it was the 800-pound phone that you pick up. But as we go through generations, we're seeing different styles of communication, and that gives us new opportunities for how to access that help. There's email and web-based, and initially Dave Fielding from the British Airline Pilots Association told me that they were going to use the internet and email for that. And I thought that was a bad idea, and that was 4 years ago. And about 2 years ago, I told him, Dave, I think you're right. And then last week at the conference, I said, Dave, I know you're right. Okay, I was wrong about that. So that's good. But we went to this conference and we found some other things too. The Japanese had developed apps where you could go in and, okay, this is our peer support program. Here's the biography of all the peers we have. You pick a peer that you want to go to. So they had done it at that level. Also, they had set up what they call a salon in their primary airport that they were at, a coffee shop, where you could just float in. And 3 days out of the week, they had mental health specialists there, a single mental health specialist and 2 peers there. And you could float in there and just talk about your problems. And it got so successful that they've opened up a commercial venture outside the airport for more people to stop in and pilots to have. It's very much like the squadron ready room when we were flying in the military, okay? So a very, very successful model there. So we need to think ahead of all the methods of communicating and how we can implement that. Volunteer training is absolutely essential. The same qualities that make us pilots make us pretty lousy peer supporters if we use those same skills that we're using in the aircraft. So there needs to be very, very specific training. I know we have Candy's back there. She's done this training 1,000 times here. I think the initial training needs to be probably multiple days, 3 to 5 days. And I do think there needs to be recurrent training, just like there is in aviation. The most important one is active listening skills. That's very tough for us who are problem solvers. Yeah, I know what's going on. I can solve this problem right away. You need to listen and receive that information in a sympathetic or empathetic way so that the person feels that their problem is being recognized and addressed adequately by that peer. I do think that the peers need to have a concept of mental health issues, a broad concept, but one of the challenges we have are getting the peers to stay in their swim lane. And we don't need a bunch of Doogie Howser peers out there providing mental health advice and diagnoses out there. You're there to provide support for the individual. I've already alluded to the confidentiality. The confidentiality needs to be very explicit, and the peers need to be trained in that. And I fully believe they need to sign a written document of their understanding of what those boundaries are, and probably do it on a regular basis. There are some legal and regulatory issues regarding certification, reporting responsibilities, et cetera, that a broad background would be useful. The accountability in the processes. Some peer programs collect data, others don't. I know in the Airline Pilots Association, there are no notes, there are no data about what the utilization rate is, what the nature of the problem is. There are probably some legal reasons for that. There are some legal reasons for that. But other organizations collect some broad de-identified data or categorical type data. Okay, we have this number of calls, and what I envision for UND, this many calls from our freshman group, this many calls from our CFIs that are out there, et cetera. And then you might drill down to this is the nature of the problem, so we know where to focus our training. But you can't get to a point where any particular problem can be linked back to a particular pilot. Any information you gather, if you do, needs to be aggregated and absolutely de-identified. Okay? Peers also need to know what resources are available for the pilot to go for help. Okay? In this environment, okay, you can go to Student Health Services. You can go to Dr. Christensen, Dr. Morgan for help in this. You can go to financial aid and see if this is going to be a problem. Okay? There are a host of problems where if you know what resources are available, because every institution dedicates a lot of resources to helping the individual who's out there. And having the peer know where those resources are, because when you're stressed out with a problem, you may not think about what all of those helps are that are available to you, those resources that can do. And someone to guide you gently to those and make you aware of that without providing the specific advice, turn it over to the experts, is very, very helpful. And then also important, very, very important, are the peers need to know what safety nets are there. And when I talk about safety nets, I'm talking about mental health, professional mental health providers, okay? Because again, you're not trained in the depth of the medical diagnoses, the nuances of what are going on. That's for the professionals, but you need to know what those professional resources are, and you need to know what the escalation policy is if we're talking about some things I'm just not comfortable with. It may be something you can turn over to another peer, a peer who might have experience in that area, but more than likely it may be something. We have some mental health providers that I would suggest you go to. One thing that we get into is the pilot needs to maintain autonomy and agency. So you're not telling someone to go see this person. You're suggesting that that person make a decision to go see that, because that gives the individual agency. They maintain their autonomy in that. They maintain the sense of self and control that they have. So directing people to those resources needs to be in a fashion so that the individual is making their own decision and reaching that decision with your assistance and insight. So this is from Dr. Becker's organization. This is Captain Andrew Forbes gave a talk last week on 9 core competencies that peers need to have with actual, I mean, he's got like, 91 different sub-criteria for all of this. But I thought this was great. And I'm sure he would make his stuff available. And you have Dr. Becker involved with UND. This is what you use. So you'll be able to train the peers in these core competencies and all the sub areas, find them. But they're pretty normal. I would say the signposting, not advice, is kind of a tough one for peers. They tend to, okay, I know what you're doing. This is what you need to do. Right? No, peers don't do that. Peers listen and say, this is what I understand you to be saying. Okay, education and marketing. I already pointed out, you all have the sweaters that you're using, the overcoats. That's absolutely wonderful. I envision people wearing uplift lanyards around at the flight training. I imagine it being in the briefing rooms before you fly. I imagine it being in the classrooms. Project Lift, here's a phone number to call, or here's an app to use, here's a QR code to scan. You need to market this. I'm wearing this HIM wings here so that it starts a discussion. And what we find with all the pilots in the HIMS program, what the heck is HIMS? They get asked by another pilot, and then they go into their story about what it is. Okay? Without the regular marketing of this, it dies on the vine. This is just like a plant. You need to cultivate it continuously. Okay? So different ideas about things that you can do. I would expect it to be a link on many of the UND website pages too that help us out there. And that also helps normalize it too. Okay? If we have it on every web page that we have, it's not unusual. You're not strange. It's on every website because it's a common problem. So that reduces that. Inclusivity. Some peers have some unique problems because of their demographics or their beliefs or their experiences. And we need to make sure that we can provide assistance for those people. Some peer support programs do have the ability to select someone, using the airline example, from either the same fleet, or if they're in a small airline, they may be flying with someone else, someone in that fleet frequently, someone from a different fleet, or female to female type thing, or someone of the LGBTQ plus community wants to talk with someone else there. The option to do that, I think, is very, very important so that all underrepresented populations can benefit from this. Okay? And then we've spoken a lot about pilots, but I really think we need to bring this to all of the aviation careers because we're all in this together for safety, and we're all humans, as much as pilots like to think we're superhuman. But we're all humans, and we all need to look at our mental wellness here. So bringing it here, I'm so thrilled that UND is bringing it down to the training level because that's relatively unique, although you don't get first prize. New Zealand did it first, okay? And they're reaching down to their training organizations too. But they're such a small country. The pilot peer support program is providing support to everyone in the airline industry, air traffic controllers, FBOs, flight schools, student pilots, everyone but the flight attendants. They're ignoring the flight attendants and letting them go on their own, which is probably an oversight. So speaking of oversight, okay? Peers are very, very good, very dedicated volunteers. But there needs to be some oversight and supervision so that when we encounter a problem that is beyond our training, beyond our capabilities, outside our swim lane, we need to know how to elevate that. We'll talk about the escalation policy in a second, but we also need to know how to communicate that to the leadership so that the leadership is aware of what's going on and can adjust the training in the future, adjust the resources that are necessary. Okay? And it requires regular communication with all the key stakeholders that are involved. The peers, the organization, in this case the university, the AMEs that are out there. They all need to know what's going on, but in a de-identified, aggregated way. Okay, and then the one that scares people the most, case escalation. What if we have a problem that is beyond our capabilities? What do we do? And the one thing that the alpha pilots always request more training on is what do we do if we get that suicide call? Right? There are a lot of things you need to train, and if you have limited time to train, there are many issues that need to be addressed, but for the level of comfort and for the urgency of the situation, knowing how to escalate something and having the resources involved is absolutely essential. And being able to access those resources quickly in those urgent situations. So that becomes very important. Little advertisement for two wonderful documents on peer support. EPSI, the European Peer Pilot Support Initiative, has two guidance, but I would say their book, it's 107 pages long. It's very good, and the International Federation of Airline Pilots also published an edition last month to their updated version. And it is absolutely wonderful in talking through all the different types of peer support programs that I listed, with the exception it doesn't have diversity and inclusion yet. But it talks about the key elements in there. And it's in a generalized format that can apply to any sort of organization. So for people who are working in this area, I would recommend those as guidance documents. Here are a couple of the peer support programs that have been out there for a long period of time. These are primarily with the airlines right now. But I hope that the future will include lots of folks, the aviation professionals that are out there, to include the full spectrum of people that are critical to the safety of the system, and that we include those people as part of our network, our family of aviation professionals that are out there. To include the ab initio students, which you are doing here. My great hope is, as I mentioned right at the beginning, that we incorporate peer support and mental wellness as part of an aviation safety management system. It becomes a critical component so that people do an assessment on this every time they fly and every time they think about aviation. This is what they're going to do. I envision wider spread support. I've seen it, Dr. Becker and I were just talking about, it seems in the last 5 years this has gotten the traction that we need. And marketing and funding. A lot of these programs are doing it on their own, but I can see aviation safety there funding this because it's important for safety. And here's a vision I was thinking of last night, that UND will become the Aviation Mental Wellness Center of the future. You're leading the way already, so continue that wonderful effort. So to summarize, peer support is very, very effective. It's good in reducing barriers to seeking out for help. It requires a lot of cooperation from all the stakeholders that are out there. It requires active management. You can't just say, we got a program, put it on the shelf and not do anything. But there is personal responsibility, and we have a personal responsibility to make ourselves the safest, healthiest, most mentally well person that we can be so when we engage in the system. And ultimately, all of those things help us in a safety management system, and we support the wellness of the individual, the agency of the individual quite well. So I want to semi-close with another quote from Wendy Santahano. She won't take credit for this, but she was the one who authored this. And I just want to read it verbatim, because I think this is the perfect description of a peer support program. And this is from Mayday South Africa, which was their peer support program for South African Airways. A first port of call when a license holder needs a safe place to talk, but doesn't know to whom or where to turn for support. Our primary objective is to provide a caring and confidential environment, able to support colleagues in a skilled, knowledgeable way through whatever circumstance or crisis confronts them, and in doing so contribute to safety. And that's really what all of you are out here to do.